Ambulance service. Is the patient breathing?
We're back on the front line.
West up, better mobilise.
Following Scotland's paramedics.
Top floor fire in a block of 4.
Got an 80-year-old female who's fallen outside.
He's been stabbed. Is the attacker still nearby? I need you to say the word now every time her chest rises.
Every day, they save lives.
Hi there.
We're the first people that people see when life can get quite desperate.
You're okay, you're not going to fall?
You sure?
100%.
And every day, they face new challenges.
Oh, they're going in with shields.
We're expected to dip into everything: mental health, trauma, medical.
But now we're being stretched even further.
Unbelievable.
Listen, I can understand you without swearing.
I laugh in the face of danger.
Sometimes you're seeing people at their absolute worst.
You're fine. You're fine.
Listen, you're in safe hands now, all right?
At the end of every shift, I can go home knowing that I've made a bit of a difference.
This is Scotland's ambulance service, serving over 5 million people in every corner of the country. This time, we're with crews in Dunfermline, Barra, and Buckie.
Buckie's a coastal town. I know an awful lot of people. I have obviously lived in the area all my life. I know I would maybe say about at least 70%, I would say, of the patients that we go to I've met before, and I know who they are, or they know me, or I maybe know their family. So it's quite a close-knit place.
It's the early hours of the morning, and Vicky and Elaine are en route to an emergency call.
2:15, and what day of the week is this at? We've got a male has been found outside the co-op, not conscious, not breathing. Their CPR is up, ongoing by a bystander. We're getting backed up by the Keith station crew, and the police are being contacted as well.
Whoever's doing CPR is doing good CPR.
We
can get them maybe keep going just till we get pads on.
And get some oxygen so we can't see how things are.
S05E06, just to make you aware, the patient has woken up and is speaking to the caller now, so patient is conscious, is breathing. I'm going to stand the backup down. If you get there, then you just fire back up if you let me know.
Thanks for the update, that's all received.
Oh well, find out when we get there. Could be a host of things.
Yeah.
They're on the road, are they?
As we were approaching, coming into Portsoy, we could see just outside the co-op that there was somebody lying on the road, and there was 2 bystanders there with a dog.
I'll just go here as the lights are shining on them.
It soon becomes clear the patient is not male, but female.
Hiya.
We did get our shoot. I was doing this.
Oh no, she's here now. Okay.
Thing, and we've got her speaking. She was speaking, but she's blanked out again.
Right, okay.
She said she takes drop attacks.
So where did you find her? Just here?
Just
yeah,
here.
were you...
I turned her around and gave her...
started CPR,
Start CPR, just kept her going until she came to.
Okay.
We're finding the last minute or a couple of minutes before you got here, she's just went
blackout again. Okay, and you said it was like drop attacks?
She says that she has drop attacks.
Okay.
A drop attack is a sudden fall that occurs without warning and which can, in some cases, be accompanied by a short loss of consciousness.
Hello, can you hear me?
We'll get her in at the motor. I'll get the trolley out. Okay.
Because we were outside, we decided that we would get the stretcher and get her into the ambulance to make sure that she was out of the cold and away from the public.
How long were you doing chest compressions for, roughly, do you think?
5.
About 5 minutes, yeah.
When I first found her, I don't think she was properly breathing.
Yeah.
But she did come to. She got like a gasp of air. Because I was wondering if she's been lying here for a while. But she said she wasn't long out.
In some cases, performing CPR on someone who isn't breathing can make it up to 3 times more likely that they will survive.
Can you open your eyes for me? Open wide, that's it. Hello. My name's Vicky.
Vicky?
Yes, and this is Elaine, my colleague, okay? We're from the ambulance.
Is Dylan all right?
Dog's here, aye, dog's okay. What's your dog's name?
Dylan.
Dylan, aye, Dylan's okay. It's you that we're worried about, okay?
Yeah.
Yeah? Do you know what's happened?
I collapsed.
You collapsed, okay.
She was chatting to us. She was responding appropriately. She said that she had no pain, and we were doing our normal assessments on her, checking our oxygen levels and our heart rate.
How do your legs and your arms feel? Do you think you're able to move your legs for me?
I'm not sure.
Just go and have a try and just see if you can move your legs. You're doing well with your arms there, that's good. Yeah. Yeah, good. Well done.
Okay,
just
take
sit
your
up.
time.
Just have a wee sit up if you can, okay? Good, perfect. I'll take that off your finger just now. Just have a wee seat there for a wee second, okay? Dylan needs a bonnet dog. Oh. Right, wait, just stay up though. Oh. Keep your eyes open.
Before the crew can administer treatment, Katrina suddenly loses consciousness again.
Is this what she's been doing? Just
She's done it once.
She's done it once.
She's done it once.
Listen to me. So you need to just listen to my voice at the moment.
It's the night shift in the control center, and Chloe is on the line with an upset caller.
Do you need to stay on the line with me? Right, okay, so that's why I want to help you at the moment.
As soon as I answered the phone, I just knew that it was going to be a challenging call.
Okay.
He was not forthcoming with giving me where he was, giving me any information to why he wanted the ambulance.
Okay, tell me exactly what's happened, what's going on. Okay, I'm really sorry to hear that, okay? I am sorry to hear that.
The caller tells Chloe he is feeling suicidal.
He wasn't angry at me, he was just angry at everything that had been going on in his life. You could hear how broken he was as well.
Listen, I understand. I know you're hurting, okay? I understand, okay? Well, listen, I know, but did you know what? You've done the hardest part, okay? The hardest part is phoning for some help. So well done you for phoning for some help today, okay?
In calls of this nature, Chloe must follow a specific protocol.
Just answer these questions as best as you can for me. Are you feeling violent? Okay. And I just have to ask, okay, do you have a weapon there? No. Where are you right now? I know you're in the living room. Okay, you're doing really, really well.
You don't want people being offended that you've asked these questions. We have to ask them. It all comes down to just the safety of the ambulance crew and to what we're actually sending them into.
I know, but if that's how you're feeling at the moment, the best thing that you've done is calling to get yourself checked over. Okay, so you should be really proud of yourself because that is the hardest part, is phoning and opening up and talking to people about it. You've obviously been through quite a lot in the last couple of weeks and I'm very sorry to hear that. But you've done, I know, but you've done the right thing in calling for some help, so you've nothing to be embarrassed by.
Chloe will normally stay on the line until the ambulance arrives.
Are you going to keep yourself safe until the ambulance crew get there? Are you going to keep yourself safe though? I know you said you're trying to, but do you feel that you can keep yourself safe until the ambulance crew get there? Well, I'm hoping that the ambulance won't be too much longer until they're with you, okay?
It's a delicate situation. Chloe needs to build a relationship with the distressed caller, but she has now been on this call for 30 minutes.
Well, you just take your time. If you don't want to talk about it, I'm right here, okay? You just let me know what you want to talk about and what you don't.
9 times out of 10 that these people phone because they want to talk to someone and they want to have someone to listen.
I know, I can hear your heart in there. But listen, again, this was the hardest part, and even speaking to me must be quite difficult for you at the moment. So well done you for calling and for letting me speak to you and letting me help you at the moment. I know you don't need to apologise.
Just letting them know that someone's there to listen to what they have got to say and that understands everything that they are saying.
I'm sorry to hear that. I am very sorry.
After an hour, the ambulance has still not arrived. It is critical that Chloe keeps the caller calm.
I'm right here on the line with you and we've got help arranged. We're just quite busy in the area. No, we don't want either of those, okay? None of those are good options. Focus on talking to me at the moment. I'm right here if you need to talk about anything. I'm right here on the line with you.
I managed to bring him right back down to my level. We started talking about what music he likes. He started telling me about his hobbies. Like, we got in a great conversation, and from managing to bring him from all the way up here right back down to my level again, it was just amazing.
You sound a lot better than what you did when you very first phoned, which is good. You sound a lot more not as stressed as when you first called, which is really good. And you seem to be having a little bit more clearer thoughts.
Other 999 calls are stacking up. Chloe cannot stay on this call for much longer.
Bear with me one moment, okay? The line's going to go quiet. Please don't hang up, okay? I'm still here on the line. I just want to get a little bit of advice in regards to the ambulance, okay? So please just don't disconnect. I can still hear everything that's going on, okay? Katrina, can I have some help? I'm kind of in this catch-22 that every time I say, G, if you're going to keep yourself safe until the crew get there, and he's going, I don't think so if I come off.
Let me go and see if they've got anyone to go to.
Is that okay? Thank you.
Chloe isn't trained to deal with mental health calls, but there are specialist clinical advisors in the control centre.
A clinical advisor's got to call them back, so
that's fine.
come
on phone.
So the lines.
That's fine. Okay, thank you.
Because we'd been on the phone for an hour, more calls started stacking in the control room. I had to then highlight it to a supervisor, who then had to get a clinician to call him back.
So I need you to listen to me, okay? We've still got an ambulance arranged for you, but one of the clinicians would like to get a little chat with you, if that's okay. So it's a paramedic or a nurse in the control room, someone who's medically trained, okay? So what they want to do now is they want to give you a little call back.
Because I'd managed to build up like a bit of trust throughout the phone call with him, I was really apprehensive on telling him that he'd then need to speak to someone else, because in my head, that's then having to build up trust with someone else, and it felt like it took him quite a while to build that trust up with me.
Are you still there? Hello? Hello? Hello?
Although Chloe loses contact with the caller, a clinician does speak to him before the ambulance arrives. Chloe has spent over an hour on the phone, but she may well have saved this caller's life.
Talking about their emotions and talking about happier things, it just makes you feel like you've made a little bit more of an impact on that person's day. It's the worst time of his life to phone, but it didn't have to be the worst moment of his life.
It's 2:30 in the morning. Vicky and Elaine are attending to Katrina, who has collapsed.
Katrina.
She is suffering frequent drop attacks and has undergone 5 minutes of CPR in the street.
Open your eyes again.
Oh.
That's it.
Okay.
Well done. That's you.
Oh,
That's you.
Dylan's there.
Dylan's there, okay? Yeah. Right, let's see if we can get you up and onto this bed. Okay? Well done. That's great.
Take a break.
So we'll take your jacket off while you're sitting up there, okay?
Okay.
That's it.
You said this has happened before, is that right?
Yeah, I take drop attacks. I've got a condition where I take drop attacks.
And what condition is it?
Yeah.
What's it called?
Has it got a name?
It's non-epileptic fits.
Non-epileptic.
Right, we're going to get you in the back just now, okay?
Right, okay. Thank you.
How often have these attacks been happening then?
Well, past couple of days, about 4 times a day.
Oh wow, okay.
I've had them since nearly 5 years ago now.
Okay, so it's quite a while
So
ago.
it's coming up with October this year.
Yeah.
It'll be 5 years.
Okay. She explained to us that she was under a bit of stress. I think we were quite confident that there was nothing new going on. It was something that the lady had been dealing with for a long time. It was under investigation.
And everything done.
And what do they think's causing it then?
It's just stress and anxiety.
Like stress induced, okay.
I feel a bit dizzy again.
Okay, just relax.
Katrina loses consciousness again. Non-epileptic seizures can happen for a number of reasons. The patient has no control over them, but one common factor is stress.
Can you open your eyes again? Look. Oh yeah. You okay? It's okay, so just check your eyes, Katrina.
Yeah.
Okay.
I didn't sleep very well last night.
Did you not sleep very well?
No.
Have you been worrying, have you?
Yeah.
Katrina's worried about her husband, who is away from home. She's had some wine to help her relax.
So you think it was tea time you had your drink, or was it after? Because it's now 2 in the morning.
Well, yeah, I had a bottle.
Over the course of the evening, do you think?
Yeah.
Yeah. If it's 7 o'clock till now, maybe?
Aye.
Just the one bottle, or did you have
well,
two?
a wee bit more.
A wee bit. How much is a wee bit more? It's okay. Can you?
1.5 bottles.
1.5. Okay. Would you do that most days, or?
No.
Can I just have a wee look again and just make sure there's no any bruising or anything? And that feels okay when I press down here?
Yep.
Once we had her in the ambulance, we were obviously looking for any like bruising or any signs of any broken ribs, trouble with breathing, things like that from the CPR, to which she didn't have any. So are you okay for us just to take you up to Dr. Gray's to get checked out?
Yeah.
Okay. Yeah. I think we'll sort it.
It's a 30-mile journey to Dr. Gray's hospital in Elgin.
The main reason that we wanted to actually take her to hospital was just because she'd had the CPR performed on her, and there was that potential that she hadn't been breathing. What about your dog? Will he be okay in the house? We could take him round the house.
But yeah, it'll be fine.
So she does have her keys on her for the dog, and she's hopping off for the dog just to go into the house.
Okay, we can easily do that.
Obviously, she was concerned about the dog, so with a wee discussion with the police, I went out and spoke to them, and they were happy to take Dylan round to our house. He might be oh, here he goes. Here he goes. Right.
He's a good boy. Yeah, he's not that old.
Are whose keys there?
Magic.
Okay. So I think she said that he was quite a stressful dog as well. So we got Dylan on board, and she got to say cheerio to him.
Go on in.
Right,
okay, Dylan.
Come on.
We get quite a lot of jobs that we attend now that there's a mental health aspect or mental health involved. I think unfortunately in this area there is a bit of a lack of resources for patients to access. Is that better, is it?
Aye.
A lot of people have got quite a lot going on, and
a lot of anxiety and a lot of stress-related things.
People are struggling like financially. There are a lot of struggles just now, which is putting extra pressure on people. We're definitely seeing an increase, yeah. There's another couple of ambulances out there as well, so we'll maybe have a little bit of a wait, okay?
After waiting more than an hour, Katrina is taken in for further tests at 5:30 in the morning.
Hello. Hi, Jean. Morning. My name's Andy, Jean, the paramedic from the helicopter. So typically with the air ambulance, there's a number of jobs we can do, as well as our role responding to the scenes of traumatic accidents. We also get what's termed routine work as well, and we kind of informally refer to them as take-homes.
In Glasgow, air ambulance paramedics Andy and Alec are preparing to transport a patient from the mainland to Barra.
We just hang fire over there till they finish this run and refuel. You all right with that? You know, a cup of tea or anything before we go? No? Sure? 5 weeks ago, Jean had been airlifted off Barra with breathing difficulties. They'd initially thought it was pneumonia, but she'd also been diagnosed with lung cancer. That had left her lungs not functioning as well as normal.
So we've got family waiting for you up in Barra? Yeah.
My son and my daughter are there.
Yeah.
She had a fairly life-changing diagnosis in the hospital, and you had to be sensitive to that as well. Although she was happy to be at home.
When I moved to Barra when we were retired, what makes it so nice actually is the community. I know the wind is nearly always there, but you live with it, and it's just a beautiful island.
It's a long distance away from your family, your house, and everything that you know.
With the helicopter refueled, the team can get Jean on board and on her way back to the island.
If you close your eyes, 10 to 10, count to 10, you'll be in Barra.
A typical air ambulance job would have a pilot. Sitting alongside him will be a paramedic who's operating as the front technical crew member. They're involved in setting up the radios, navigation checklists for the pilot, the aviation aspect of things. In the back of the aircraft, the other paramedic who's ultimately responsible for the patient. Just for your oxygen levels, Jean, I'll pop this wee thing back on your finger. Is that okay?
Yeah.
I'll keep an eye on your oxygen levels, and if required, we can give you some.
Okay guys, starting engines. Okay, all clear right, clear left.
Departure from Ghana, cross runway 23, and traffic with an ops vehicle on the runway.
The helicopter must now travel the 140-mile journey to Barra, where Jean will then be transferred to her local hospital.
Ghana receiving, over.
Hi Scott, good morning, it's Paramedics 5. That's us off to Barra now. Fuel mission endurance is 2 hours and 20 minutes. ETA on Barra is 11:35, over.
Roger, Helmet 5, fuel 2 hours 20, ETA 1135 local, over.
Of all the sort of routine places we would go to, Barra's the furthest. It's about an hour's flying from Glasgow. Everyone says it is a particularly nice flight. It's some incredibly nice scenery.
It's my favourite weather to fly in.
That's why I like my job. Because of this flying, it's great, eh?
There's a slightly different dynamic to routine transfers. You know the patient's condition, the fact that they're getting stepped down to their home hospital, they are fairly stable.
For Andy, aviation was his way into the ambulance service.
I worked in aircraft engineering for the first 15 years of my working career. I was happy in that as well, so I'd probably still be doing that till the day I retired. I'd still be working in the aircraft somewhere, yeah.
55 minutes after leaving Glasgow, the team is approaching Barra.
Okay, visual with the pad, all looks nice and clear.
Gamma, it's Helmet 5, that's us on the ground in Barra, over.
Roger, Helmet 5, many thanks, Gamma out.
Okay, Jean?
Yep.
Is that okay?
Yep.
Feel okay?
Okay.
The ambulance is waiting for you just to get you back down to the hospital.
Exciting there.
Exciting, was it? Open the doors, you can see. You've got a good view.
Barra Air.
Barra Air. It's not windy. I've never been here when it's not windy.
Yeah, there's something wrong.
You okay? Yes. Hello. Hello, hello, hello. Nice to see you.
There is a lot of the work we do is perhaps routine, just transfers. You don't do a huge amount. But you know that you've made a difference to someone's life. if you've taken someone home, they've been away from home a long time, you get to see them happy that they're back with their family. These are all nice things and good parts of the job.
With the transfer complete, the crew can begin the journey back to Glasgow. But they need to make a quick stop-off.
Okay, coming around to your side. Clear left. Tail is clear around to the right.
As Barra is one of our longest routes, fuel can be quite tight at getting there and back. So we have a fuel stop at Oban that we can utilise.
Inbound for Oban for a refuel. Random discretion, air taxi, Hotel 2, Heliman 05, okay.
For Tango Romeo, November, for Convoy 6515.
Hi, Gamma, Heliman 5, that's us on the ground in Oban.
Roger, Heliman 5, many thanks.
I'll do the plan.
Yes, go ahead.
As the team begin to refuel, an emergency call comes through the radio.
We were contacted by Control to inform us that there was a job in the very near vicinity, and we were going to be one of the closest resources to it.
Yes, potential HEMS job in Inverary. Male came off the water by the flow in approximately 50 metres. His foot has been described as broken and bleeding, and you can see the bone through the top of his foot.
Roger, that's all received, thank you.
Inverary is a short flight from Oban, but the incident sounds serious, and there's lots of refueling still to do.
The area we cover is massive. I mean, I've come from London, and you have one area you're like maximum of 20 minutes from a hospital. You come to East of Scotland in Fife, and you are talking, you could be easily an hour to a hospital. You can go quite a distance for travelling. You've got a massive diversity of people and different kinds of jobs. You can go from an accident in the town to a farm accident in the country, all in one shift.
Crewmates Davy and Eileen are ambulance service veterans with 65 years' experience between them. Today, they are answering a call from another town in Fife, St Andrews.
I'm just looking at all these lovely golf courses that I could be on, and then thinking to myself, could I think up some fictitious disease that I've got that I would need to book off and go to the golf course?
We've been working together probably 5, 6 years now.
We will be, yeah.
They pay me extra to work with them. He doesn't know that yet. He does now.
There's the golf. We're all out golfing. I've got to say it back. You need to stop. I need to get out.
Shall I just drop you off here?
Just drop me off here.
There's got to be trust between each other as well.
Yeah.
I've got to trust Davey on his decisions, and he has to trust my driving.
My life insurance company might say different.
He quite often drives down the road, or I'm driving down the road, and if somebody pulls out and I see starts shouting, we're going to Barbados, because he thinks he's going to get a payout.
Right, get a payout.
To this day, he's never had a payout.
Never had a weekend in Burnt Island, never mind Barbados.
Davy and Eileen are en route to a 65-year-old woman who has fallen at home.
The only information we have, it's a stretcher required because she has a knee injury and is unable to mobilise.
The patient has been stuck on the floor and struggling to move for over 2 days.
I think to get to St Andrews from Dunfermline is about, I would say 40 minutes. It's a good run because you're going down to the coast.
It means that there's obviously no other available resource, especially for that distance.
It's the main door, 65-year-old.
So, you have a sore leg?
Yeah, my knee hurt. I've tried standing with that. I can't put any weight on it at all. Do I have a look at it?
Yes, please. Oh, aye.
Linda hurt her knee after tripping on her dog's bone.
She had been on the floor, unable to move. She was basically crawling around, bum shuffling and that to go to a toilet and that.
Earlier in the morning, her son travelled from Glasgow to help her into bed.
Okay. I see it here. It's sitting to the side. Yeah. Is it sore if I do that?
Not really. Oh, yeah.
She was complaining of this knee pain. Now, the pain itself sounded muscular. On examination, it didn't look like there was a fracture, but you can't outrule that because I don't have an X-ray machine with me.
I think it's just the bruising.
Could very well be just like that, but if you can't put weight in it and you're on your own, that's the difficulty we've got here. We'll just do a wee temperature gauge there.
37. So what did you do for food and that while you were on the floor? You've not had anything all weekend?
Well, I managed to get a couple of biscuits for Bob Cook.
Oh, jeez.
I don't know why she took so long to actually phone for help. She thought maybe it would heal and then she was going to be okay. Unfortunately, that was not the case.
So when you fell over, did you fall backwards? Did you fall forward?
Forward, right onto my knee.
Davy calls St Andrew's Community Hospital to see if they will admit Linda.
Who's the picture?
That's my mum and dad.
Is it? I don't know, when was that taken?
Long time. My mum was Dutch.
Oh, was she? So how did he meet her?
She come over here to do a nursing.
Right, they said that they'll have a look at you. I don't think there's a fracture in it, and I don't think it's dislocated, but they will have a look at it. It probably will be a bit painful in that, like, but have you taken any pain medication at all?
I just had some ibuprofen.
Ibuprofen. Are you taking brufen and paracetamol?
No.
Just brufen. I've got to make an assessment to say, is it safe for her to be left at home on her own? And the decision was no. All right?
Yeah. Sorry, honey.
It will be painful, darling.
Okay. You didn't brush your hair?
No, I never brushed mine either, hen, so you're all right. 2, 3, push up.
That's it, well done.
Oh, yeah. Oh.
Yeah, that's it, you're done.
That was super quick.
I told you, it was just the
top
top
of the fire was
hill.
going that.
Oh,
Going down. Okie doke.
At hospital, Linda's knee will be x-rayed to see whether it is fractured or she has damaged her ligaments.
from Helimed 5. We have just lifted from Oban and are en route to your location.
The Helimed team are on their way to Inverary on the banks of Loch Fyne. A motorcyclist has collided with a car on a busy road just outside the town.
You start thinking about what to expect. Motorcyclists obviously don't have the same protection as a car, so incidents involving them can be very serious, with very serious injuries.
You're right over the scene here. Okay, there's a police car, there's an ambulance, there's somebody on a stretcher.
The Helimed team will provide vital assistance to the ambulance crew on scene, but there's a problem.
There is nowhere to land there. There's a lay-by there, but they'd have to clear for us.
There are strict regulations about where we can land a helicopter. This can be quite challenging. You need to make sure it's somewhere relatively close to either get us to the scene or the patient to us.
What about this field here, just in the village? There's the castle, they're going to have to go, that's the castle entrance up there, so that would be the closest, wouldn't it? Right, the only thing is there is a power line in there. So, okay, so I've possibly identified the power line that's running around the north. That looks the best to me, car park there. Happy with that?
Yeah, I am happy with it.
Okay, it's nice and flat. We are into its very light wind, so we'll make the approach in this current direction now. Okay.
Fortunately, just down from the scene, there was a particularly large car park, which was empty. As it was a car park, there was going to be good access.
Okay, so I've got some cows moving. I've got the visual with the power line. I'm over the power line now.
The power line is coming to my side now. It's
and landing
visual.
from here.
Yeah.
Hello.
advised they've landed at the plane field south of the castle. Following Helmet 5, can you confirm our placement here at the moment?
We are in a police car and we're heading to the scene, over.
As you approach a traumatic scene, before you even see the patient, you're trying to pick up on what might have happened. We could see that car that had been clipped. It was a significant distance away from where the motorbike was now lying. Thank you very much. The patient had travelled about 50 metres down the road.
Hello.
Oh, here we go. Hi, my name's Andy, the paramedic from the helicopter. Alex down at the bottom end here as well. So we're just having a look at your leg and your obs just now. And then we'll come up with a plan and get you some decent pain relief on board, all right?
The motorcyclist is the only patient from the incident.
And what's the last thing you remember?
I don't.
You don't? You don't remember anything? You don't remember feeling unwell or anything?
No.
No?
What's the worst pain just now? You tell me.
My right foot.
Your right foot is the worst pain. I'm gonna have to probably remove your sock from your right foot, okay?
They had a degloving injury to their foot. So this is where there's been a shearing force between a body part and another surface. His foot had been dragged along the road and the top layers of skin and tissue had been separated from the underlying structures. Having a significantly painful injury can distract you from other injuries. If you, for example, have got a neck injury or a back injury, you have to be mindful that there may be other injuries that they're not focusing on because of the pain that they're currently in.
The crew examines the patient's leg for further hidden injuries.
You tell me whether it's sore or not, okay? Is this sore?
No.
Is this sore?
No.
This one?
No.
Can you feel normal though?
Oh, dear.
This here?
No.
Okay.
Burning.
It's burning here? Okay.
How about the front of your ribs? Are they sore? Just all on the back?
Aye.
And is it much worse when you take a big deep breath in? Don't hurt yourself, but that's significantly more painful. Okay. Your hips feel okay? The tops of your legs feel okay?
Yep.
What about the left side of your body? Is it completely fine? And your neck's not sore? No? Okay. Your observations-wise, there's nothing really jumping out as completely untoward. Your right foot's got quite a laceration in it. It's all bandaged up and you've had to wear antibiotics, all right?
Oh, sorry for thinking.
Sorry for what?
Sorry for thinking.
Don't be daft, don't be daft. It's not your fault. Accidents happen all day. The patient was talking throughout, which was a good sign. He was what we'd call GCS 15, which is a normal conscious level. It would indicate he didn't have a significant head injury, which is a good thing.
Well, the bite looks good.
Your leathers did a great job, mate.
Your leather saved your life.
Yeah. Ready, set, lift.
1, 2, 3.
I was very mindful throughout that there will probably have been some concealed injuries that we just are unable to assess at scene. The road transfer would be significantly long, so a very early decision was made that we would be taking them by air back down to the central belt.
The HeliMed crew take the patient to the major trauma centre at the Queen Elizabeth Hospital in Glasgow, where his injuries can be assessed more thoroughly.
1, 2, 3.
Ambulance service, is the patient breathing? And is the patient awake? Okay, tell me exactly what's happened.
Today, Pam is taking a call from an elderly woman worried about her husband.
Okay, that's fine. And are you with him now? All right. Is he breathing normally? So we need to do a quick test on him for the medics before they arrive. I want you to get close enough to him to ask him to do 3 things. Tell me when you're ready.
The patient has been suffering chest pain and weakness down his right side.
To me, it was showing symptoms of a stroke, so then I would go down the stroke diagnostic protocol. Okay, are you right beside him? You are. Okay, ask him to smile. Okay, so was the smile equal on both sides of his mouth? It's the same on both sides, is that correct? Yep, okay, that's great. Now ask him to raise both arms straight out in front of himself and hold for a moment. So we're checking the patient, we're checking their balance, so we ask them to put their hands straight out in front of themselves to see if they can hold. Was he able to raise and hold both arms equally? Okay, so was it raised at all, or was one lower than the other? Right, okay. If you can ask him to say these words, the early bird catches the worm. We're checking their speech. So we ask them to say a phrase, the early bird catches the worm, and this just tests the speech, whether their speech is normal or if it's slurred, not understandable, garbled speech. Okay, so was he able to repeat it correctly? A little bit slurred, okay. Thank you for doing that test for me. Okay, so exactly what time did these symptoms start? It is very important to get the exact time when the symptoms started. A lot of people wonder, why are you asking me that question? But it is very important because a stroke is time critical.
If a crew can get a patient to hospital for treatment within 4.5 hours of the first symptoms emerging, then doctors have the best chance of minimizing long-term damage.
No. Right. That's fine. Okay, so I'm organising help for you now. Stay on the line.
This patient's symptoms started early that morning, over 9 hours ago. It means the emergency stroke treatment is unlikely to be effective.
If he becomes less awake and vomits, quickly lay him on his side. And if he gets worse in any way, call us back immediately for further instructions.
The ambulance service remains under pressure and response times can be long, even for time-critical incidents like a stroke.
Just to inform you that we are experiencing very high call volumes at present. We will respond as quickly as we can, but there may be a delay before arriving with him. Is it possible for him to be transported to hospital in any other way? No. That's okay. If you just wait for the ambulance to come, and we'll be there as soon as possible, okay? Okay, right, thank you now. You take care. Bye. Bye now, bye.
Even though the patient has suffered a suspected stroke, he's been classified as a yellow response.
If it's within 4.5 hours, then they will get an amber response ambulance, which is a higher response ambulance. But because this one here was 8:30 this morning, which was out with that window, it's then classed as, if it's a stroke, it's not reversible. So it's then a lower response.
Pam has spent her life in Scotland's emergency services.
I've actually worked for the 3 emergency services now. So I worked in the fire control, I worked for the police service. I know that it can be stressful at times, but it's very rewarding. You're helping people, and I just love the job as an emergency call handler.
The details we have at the moment is a 48-year-old that's been found lying outside Aberdour Road in Dunfermline.
Davy and Eileen are responding to a call about a patient who's been found unconscious.
Paul, I'm sure I know this guy.
Yeah, we've had him twice.
Aye, this will be the 3rd time.
We knew Paul from a couple of other times we've had him in the street where he's collapsed, and unfortunately Paul's an alcoholic and he knows he's an alcoholic, fully admits it. He just, sometimes everything just gets a bit too much for him and he takes a little bit too much.
Oh, how about the road?
Oh, there we are. As we're driving down the road, we could see Paul lying on the pavement.
Here we go.
By the time we got there, he'd come round. Paul, the lady said you hurt yourself a couple of weeks ago. What, here?
Can we have a wee look, sir?
Yeah. Your ribs?
Aye.
Is it sore?
Aye, I can't breathe.
Paul recently suffered a rib injury in a car crash. He is out of breath and in pain.
Can we do some observations on you, son?
Should we get you up?
You just sit like that.
That's it.
There you are.
Good
All
man,
right,
well
good
done.
man.
Should we get you in the back
You
of
manage in the back of the ambulance?
I think so, eh?
Seems like I got to puncture my line.
You punctured your lung?
I think so.
If Paul's sudden breathlessness is because of a punctured lung, he will require hospital treatment. The crew need to find out more about his car crash.
Well, I was in a car accident 2 weeks ago. I hit the sign at cross gates, which had come off.
Oh, was that you? The car's still there?
No.
The silver one? Silver car?
Oh, it might be.
Yeah, it's still there.
I hit the sign at 8 foot high in the air.
Yeah, you made a bit of a mess of the car, didn't you? We saw the car. He'd clearly gone off the A92 and gone up. I don't know whether he intended to take the slip road for Holbeath or whether that's just where he ended up, but the car was there for about 2 weeks, 3 weeks. And it was literally, I would say, 10 foot up into the trees. And he actually walked away from that and just with a few broken ribs. So did you go to the hospital?
Aye.
Eileen uses a pulse oximeter to measure the oxygen level in Paul's blood. A low reading could indicate an underlying lung injury.
Are you a smoker?
Yeah.
Right. Your oxygen levels are actually pretty good, mate. It'll just feel because you can't expand your ribs because they're broken, so it feels like you can't breathe properly. I've had broken ribs myself, I know what it's like. Oh, I wouldn't wish it on my worst enemy.
No, it's very uncomfortable.
Yeah.
I don't honestly think that you've got a punctured lung in that, because obviously if you had, you would be in a lot more pain and you wouldn't be breathing like how you are.
All his actual observations were fine. Although he did say that he was feeling a bit unwell, he was still in a lot of pain, he knew what was going on round about him, was able to answer questions, understand them.
So the choices we have is, because your rib pain happened about a week ago, right, there's very little they'll do bar give you pain relief, and I dare say you're on that at the moment. You're not taking paracetamol or anything. You should be.
Right.
Do you have pain relief? Have you seen your GP or anything like that about this?
Oh, no.
You really need to go and see him and get pain relief for that. Or the other option that we have is, I can take you to the hospital. There is a big delay, right enough, by going there, but I dare say they'll just give you pain relief as well. But the problem with that is you can't drink with paracetamol.
Well, I can't not drink.
Well, that's the problem. If you take paracetamol along with alcohol, it can make you vomit, but I dare say you'll know that.
Aye.
Or any other medication. But it's entirely up to yourself what you want to do.
Go ahead.
Will you manage all right getting up the road?
Come on. I've tried my best.
Is somebody at home?
No.
No, right.
I need to go to Tesco's or Aldi.
Was that where you were heading? Right. So if we drop you off up there, you can get some paracetamol up there as well.
Yeah.
Or ibuprofen, whatever's easiest for you. Whatever you can take, which is best.
So.
I know. Just try, don't keep bending over like that because you're putting pressure on your ribs. He was more interested in getting up to Tesco's. So rather being safe than sorry, rather than try to watch him stagger up the road, we decided to give him a lift to Tesco's. Get what he needed, sort himself out. We were standing chatting to the chap just to really try and get a bit of history on them. Where did you work?
Harrods.
All right. What, security?
No.
No, what were you doing?
Electrician.
All right. How long were you there for?
5 months.
Uh-huh.
I've worked in London most of my days.
Have you?
Well, aye. Cardiff.
As an electrician?
Aye. I used to work for M&S.
All right. Oh, what, and going around the stores? Doing the stores and that? So what made you come here? Or is it just a case of coming back home? We'll drop you off at Tesco's, all right?
Perfect.
The crew make a short detour on their way back to base.
We've had Paul a couple of times. We've never gotten the full story out of him about what's going on.
All right, son, take care, eh?
You start getting stuff out of him, but then he kind of clamps up, so I'm not sure what's going on. I don't know. Sad. It's sad to see him, because he's only a middle-aged guy.
I was carrying your bag last week as well. It's unbelievable.
Aberdeen has got a bit of hustle and bustle about it in the city centre, but then you've got the advantage of kind of going 10, 50 miles south, 10, 50 miles north, and you're kind of worlds apart. You've got kind of amazing countryside, nice walks and things like that. I think we're very lucky living where we do. But being Aberdeen born and bred, it's quite nice working here and just being able to just, I guess, embrace it all.
Rachel and Scott have been crew partners for 6 years.
See, I told you should have went before you left. That's the rules.
I didn't have time.
You should always pay before you go on a job. We've got quite a good station. It's a busy station to work at. A lot of young members of staff now coming through, and it's good to see the freshness amongst the staff.
Okay, so we're going to a male with an ankle injury at one of the universities in Aberdeen. Apparently his foot's pointing the wrong direction.
Hello! Where are we heading for?
Just park here.
Park here.
And then I'll take you just to the end of the building there, and we're getting through the exit there.
Grand.
Okay, mate, anyways.
I'll just tighten in a little bit.
This is Fraser. Hello, Fraser. Listen, my name's Scott, so what's happening, pal?
Dodgy ankle.
How did it happen?
I'll play football.
Okay.
Went for that one-to-one.
He had been in for a tackle and basically rotated his ankle, and it was quite obvious to us he'd a fracture dislocation of his ankle due to the deformity of the ankle.
Five-ish.
So my colleague's just come in with some Internox gas.
Yeah.
And we'll try and get you a bit more comfortable, mate, okay? You ever had this stuff before?
No, it was the same as with the wife that had when she was pregnant.
Yeah.
Aye.
Did you not steal any then? No.
Internox is our pain-relieving gas, commonly known to many people as laughing gas, and it's just enough to take the edge off things. It works very quickly, but wears off just as quick as well.
Fight on that, create a seal here, look, nice, slow, big, deep breaths in and out of there, pal, okay? What I want to do is we're going to try and get you on your back. Just keep going with that stuff just now, though, okay?
Take a good few puffs.
He was a hardy chap and wasn't a massive fan of needles, so he didn't want any needles with regards to stronger pain relief. So he managed really well with the Internox gas. He was a brave soldier, shall we say.
On a scale of 0 to 10, right, 0 being no pain, 10 being the worst pain you felt, how are you scoring at the moment?
Honestly, well, 5 or 6.
Okay.
5 or 6.
Okay, keep going with that stuff and we'll see.
Right, pal. Keep taking that, but give me up this arm at the same time. So how serious is this football?
Do you know what? I've only played 3 times.
Oh, have you? Is it just a kickabout?
Yeah, it's kickabout.
Is that gas doing anything for the pain?
Yeah. Does it make you tired?
Tired, drunk.
Yeah. So have the yolks.
That's fine. That'll do.
The potential of that injury can be quite complicated. The fracture is so bad in that area, it can cut off the blood supply to the foot. So it's quite important to us initiate straight away that he had a good pulse in his foot to make sure the blood supply was there.
I'm just going to slowly take your shoe off, pal, okay?
Just keep with the gas. Well done. Ace. Right, listen, don't you move your leg. Just,
so hard not to.
I know, pal. But just you concentrate on
Yeah.
moving yourself around. If I can guide you, then happy days. That's it, well done. Well
Watch your leg.
That's it.
The injury is so unstable. Any wrong movement could have a detrimental effect. And that's why we use the equipment that we have, like the box splints and things, to keep injuries like this secure. The patient was quite squeamish. He wasn't for looking anywhere near his ankle. I think at maybe one point he had a wee peep, but yeah, he was like, oh, I'm not looking at that. I don't need to see that.
I'm not going to pull that.
Oh, no.
Right, pain score out of 10 now, would you say?
It's alright. Feel fine?
The gas is working then?
Yes, it is.
Okay. So the plan of action will be, we'll get our stretcher in about to here, we'll get you sitting up and we'll get you onto the bed and we'll get you up the road for an x-ray, pal, okay? Dodgy ref, was it? They're all the same, man, they're all the same.
You've got to be very careful like dealing with these kind of injuries because there's quite a high chance that the bone can come through the skin.
So no allergies, no medication.
So it's very important that we try and keep him as still as we can, and that's why we got it into a splint.
Easy as it. Now, there'll be a couple of bumps coming out of here, pal, okay?
He did really well managing his pain.
We bump again, buddy.
He was in a good enough place where we could get the bed right in, and it was just really unfortunate for him that he sustained such a horrible injury.
Given the severity of Fraser's injury, Scott pre-alerts the hospital.
Well, the last patient went to queue for 4 hours to get into the hospital. Yeah, it was that busy. But because of your injury, I phoned ahead, so hopefully we'll get straight in. What? No, it's just because it needs treated straight away, that's why. No. I'm hoping we're going to get straight in.
Yeah, but they're obviously stacking, like, but we're there to try and make a difference. And I think if we can go home at night knowing that we've done that in our day, then that's all that matters to us. We're going into recess. It's obviously a night for football injuries though, because there's somebody in, I think maybe like a dislocated elbow.
All right.
And they're screaming the Houston. And it's absolutely pouring that it's just gone down my back. Ah! Right, a few bumps and you're going to get soaked, okay?
Yeah, that's right.
Ooh! That's a man.
It's Houston, isn't it?
It is hot, yeah.